we're meeting virtually now. Sorry we missed everybody. We were looking forward to seeing everyone at the National Harbor in Maryland, but COVID has called us to be at home now. So you're going to hear our voices. So our topic is acquiring an advanced degree as a pathway for clinical dental faculty development. I'm here presenting with Kevin. My name is Sophia.
I'm Kevin Luan.
And we're going to talk to you about how our topic came to be. We, as a group, we felt really confident in August and that we had our topic down. And the first one we did, you remember that, Kevin, it was about mentorship, wasn't it?
Yeah, but the problem was that we looked into that and found out that that had already been published before we even tried to start the project, which was a bit unfortunate at the time.
So here we were scrambling, and we had the bright idea to ask the librarian to help us. And she said, instead of looking for a topic and then researching the survey, let's work backwards. Look for what's been published in dental education and then find what's not been published. So then we came with a brilliant idea to talk about advanced degrees and support for that in institutions. And then we found out, although it's been done several times, there was only a questionnaire and a systematic review. So we thought that, all right, this is a great idea. But then guess what? We found out that an emerging leaders group had done it a year or two before and just published as we were getting ready to hit send to Tobias. So here we were with two failed topics, and we got a little frustrated, but then we didn't allow it to affect our progress. So we came up with our third topic, which we're going to talk to you about today.
So just before we get into too much detail about our project, we'd like to introduce the rest of our group who couldn't be here physically with us. So on the picture that you can see right here, from the left to the right side, we have Mohamed, who is from the University of New England in Portland, Maine. We have Victoria Patrounova, who is from Houston in Texas. Myself, I'm based in Chicago.
And from my side, this is Sabrina from University of Michigan. We have Sarah from Tufts University, and then myself from the University of Colorado.
And our advisor, Dr. Michelle Robinson, was one who graciously took our photo next to our banana. For those of you who can remember, we did a presentation during the Shark Tank exercise.
That was a lot of fun.
That's one way to remember us. And so for those of you wondering why we called Molar Express, it didn't have anything to do with the banana. It just so happened to be that the artwork was well drawn by our resident prosthodontist, Sabrina. So, moving on to the purpose of our topic, our project objectives. We designed this to examine the dental faculty attitudes and interests towards acquiring advanced degrees such as a Master of Public Health, Masters of Business Administration, Master of Science, MA, Master of Education, etc., for their career development. Also, as well as that, we wanted to identify barriers to pursue advanced education, as well as recognize the need for changes to overcome these barriers. Ideally, the results of this survey will inform dental school administrators on the faculty's interests in advancing their own education and development. This can also guide into creating programs that prepare dental faculty to carry out a full range of responsibilities as an educator. So looking into the literature review that we did as a group, some data that was published by IDEA showed that about 51% of new faculty members typically come from private practice, whereas 18% were from graduates of advanced education programs. And about 4% of dental school graduates become faculty immediately after their dental school graduation, with almost 67% indicating that they would plan to teach at some point in their careers. The problem was that most new faculty members had no formal training in teaching or research, so the transition from clinical practice to academia could be challenging due to lack of knowledge and skills. So with a range of curriculum and syllabus development, writing objectives, exam questions, providing feedback, using new technologies, these are things that we felt were important when someone transitions to education. Moving on to our methods and materials. We designed a survey test with a number of questions. We had first decided to do a pre-test of these survey questions to prove validity and reliability. And once this was approved, we were planning to distribute these to approximately 1,800 dental school faculty. So the survey is planned to be distributed electronically to dental faculty via an email link on the survey on Qualtrics. After initial survey email, up to 2 additional reminder emails will be sent out to the faculty over a maximum of 6-week period. This survey will be sent to faculty at the 6 dental schools that we in the Molar Express represent, and the survey is designed to be completed under 10 minutes. So the inclusion criteria are the dental and dental hygiene faculty, full-time, part-time, and volunteers at Tufts University School of Dental Medicine, University of Michigan School of Dentistry, University of Illinois at Chicago College of Dentistry, University of Colorado School of Dental Medicine, University of Texas School of Dentistry at Houston, and the University of New England College of Dental Medicine. The exclusion criteria for the survey distribution will be dental and dental hygiene faculty that are not participating in the study.
And just to let you all know, at this time, five of our schools, the IRB has been approved. We're just waiting for one more university to approve it, and naturally it was perfect timing with COVID, so things are a little bit delayed.
So the first part of the validation was content validation. The rating of we rated the importance of the questions in the survey instruments, and they're rated by 3 separate faculty development directors or faculty staff leaders that are involved in faculty development programs at one of the 6 participating schools. Each question was rated on a Likert scale from 1, very important, to 5, not important, and also to rate whether each question should be included in the survey.
Face validation. So we have face validation to ensure that the survey questions are easy to understand, useful, simple, and necessary. The survey will be reviewed by 3 dental clinical faculty who participated in the IDEA Summer Program for Emerging Leaders in 2019. They do not take the survey, and they'll only give back feedback on comfort in answering the questions and any trouble with answering the questions. Our survey instrument consists of 26 questions. The first part of the survey is general demographics of age, gender, what their position is at the school, full-time, part-time, how long they've been teaching there, where have they taught elsewhere, and to find out if they have an advanced degree and where did they attain it prior to coming here to their current institution, or is this something they're pursuing currently, or did they have that prior to even coming to getting their dental degree? Some of the questions we've included today for your information is, do you have an advanced degree or certificate in addition to your dental qualification, their DDS, DMD, BDS, or dental hygiene? Which advanced degree program have you successfully completed? And we had them select all that applied. When did you obtain this or these advanced degrees? Do you feel pursuing an advanced degree is necessary for career advancement? And so similar questions that we have are, what were the reasons why you did not pursue an advanced degree? Select all that apply. Some of the answer choices we gave our participants are no interest, lack of time, financial burden, personal reasons such as family, no programs available at my institution, or others, and we left an open space for people to identify their reasons. For data analysis, we're going to be using descriptive statistics, which means our means and standard deviations for continuous items. We're going to count, and percentages for categorical items will be calculated. Thank God for Sarah, because this is her forte, and she'll be able to help us. We got really, really lucky. She got placed in our group. Associations between categorical variations will be examined with the chi-square test or with the Fisher exact test in the case of sparse cell contents. A logistic regression model will be developed to control for potential confounders. All p-values less than 0.005 will be considered statistically significant. Stata 13.1 will be used for the statistical analysis.
Thank you very much for listening to our project. We'd love to hear your feedback, questions, concerns to help us move our project along. As Sophia mentioned, we are almost there, ready to submit this and send these surveys out to these 6 institutions. Just waiting for one IRB, and then we should have hopefully data between now and next time we meet up.
So look out for those inboxes during COVID. These are our references from where we've gathered our information and where we've pulled some of our questions. We hope you enjoyed our talk today. Thank you.